Hello, Dr. Ankesh. Thank you so much for joining us today. Today, we're going to be talking a bit about hormonal health and going in depth and understanding more about some of the issues that, specifically women face with hormonal imbalance, and also learn a bit more about the different hormones in our body. So before we start, just want to introduce Dr. Ankesh quickly. Dr. Ankesh is a gynecologist and obstetrician practicing in Mumbai, and he's going to be talking to us about hormones today. So thank you and welcome. So let's, start off with a very basic question that a lot of people have asked us about, which is what are the hormones that typically affect a woman's body and their health?
So every hormone is important. Actually, there are more than 4 to 5 hormones that specifically a woman's reproductive life is affected by. We'll start with the main ones on the brain. The pituitary gland, which is the FSH and LH hormone that determine a woman's periods, her fertility, her cycle length, her regularity of periods. Then the thyroid hormone in the neck, the thyroid gland, TSH and the T3, T4. Then there's a hormone called prolactin that is very important in production of breast milk. Also, it's raised in conditions like stress, uh, anovulation, PCOD.
Right.
And again, I would like to go to the male sex hormone, free testosterone. In a certain amount, it's important for the female libido, for the characteristics of a female. But if it's higher and higher amount, you get problems like acne, normal hair growth, oily skin, things like that. Then
Right.
there's insulin. Insulin is the main hormone on the pancreas that's important for consumption of glucose. So that is also raised in PCOD. So various factors are there, but these are the common ones.
Right. Thank you. I mean, I think that's important, and a lot of people, don't know the different hormones that can impact your health. But I think the big question that I mean, everybody wants to know is what really causes these hormonal imbalances in women. We always hear about, oh, you have hormonal imbalance. That's why you get excess hair, acne, PCOS. But what is really causing these hormonal imbalances in our body?
So there are many factors. So you won't believe it. In majority of the books, they say PCOD, for example, is the most common thing. The cause is not known.
Right.
But what we've diagnosed, it's mostly genetic or it's a lifestyle issue. The girl's mother or grandmother or someone has had it in the past in ancestry, or the lifestyle is very bad. A lot of junk food eating,
Right.
a lot of sleep disturbances,
Right.
abusing your body, all the things like excessive alcohol, wrong time of sleeping,
Right.
consumption of high carbohydrates, fried foods, sweet foods, no exercise, sedentary lifestyle. This is like the recipe to disaster for irregular hormone imbalance and irregular periods.
Right. And I think a lot of people assume that hormonal imbalance is just PCOS, but actually there are a lot of other things that can happen with hormonal imbalance, like you mentioned with thyroid and testosterone as
Yeah,
well.
yeah, major. Now you might have a girl who's absolutely fine. Her ovaries are normal size, but her thyroid hormone is very high or her insulin hormone is high. This could lead to other problems like pigmentation. There's something called as acanthosis nigricans on the nape of the neck and the groin. You'll see a lot of pigmentation. You'll see a very obese girl in her early 20s or late teens with abnormal body hair growth in the jawline. She'll have hair growth.
Right.
Various things. So this is all again, you can say a component of PCOD, but not proper full blown PCOD.
Right.
So it depends. We see case to case difference. You might see only one hormone raised in a person. So it varies.
Okay. And when really in the woman's life cycle do you typically detect or see these hormonal imbalances taking place?
Early. If the lifestyle has been bad from childhood, she's been eating the wrong foods given by her parents and no curtailment, no force, no exercise done, nothing at all. Mid teens, late teens, early 20s, bang on.
Yeah, I think a lot of girls, especially, I think between 16 and 21, tend to face more of these hormonal
Correct.
changes. And you mentioned that a few of those signs and symptoms are, excessive hair growth and acne, sometimes leads to obesity. Are there any other common signs of hormonal imbalance that you can detect early before it gets to a more serious stage?
Periods being irregular, getting a period more than 35 days later, uh, weight gain, incessant weight gain, not able to lose weight despite exercise and diet, and like you said, abnormal hair growth, acne, and at times nipple discharge, at times in high prolactin.
Okay.
So these are the signs of hormone imbalance.
Okay, and I think something that I mean I would also want to understand is how do you differentiate between, say, a normal hormonal imbalance, something like a mood swing before your period, versus something more serious like, causing PCOS and thyroid and things like that.
So what you're calling a normal hormone imbalance is the PMS. So
Right.
before a girl gets her periods, the hormone levels are at a high peak. The hormone levels drop. That's when a girl gets her period. So that's PMS that every girl gets. If a girl has the same PMS symptoms over the course of years, it's a normal standard thing. But if a girl has a prolonged PMS, say 15 days to 20 days, if a girl has missed a period, it's been over 45 days. If a girl's gaining weight, like you can say 10 kgs over 3 months, that's all abnormal. So that's when you have a hormone imbalance.
Okay. And how would you detect or test for these hormone imbalances? Like you would have to get a blood test, or do you
Yes,
also
yes.
need an
So
ultrasound?
you have to go to a gynecologist. You have to get an ultrasound. You have to even get your periods induced. You can't get your blood test anytime. You have to get your periods by withdrawal tablets of progesterone. Once you get your periods on the second or third day of the period, you'll do your hormone tests.
Okay. And what specific tests do you have to take in like form of blood test to
So
detect?
the basic, I'll give you the basic profile is LH, FSH, prolactin, TSH, insulin, and testosterone. So this is the basic. There could be one or two added depending on the case, but these are the basic set of hormones.
Okay. And how often should you get these tests done?
If you're under medication, you're under treatment, if you have to be monitored once in 3 months to maybe once in 6 months.
Oh, wow. Okay. I haven't done mine in a year, so I think.
But if you're fine, then why are you worried?
Yeah. Um, so then, what are the remedies or fixes for something like this? I know a lot of doctors prescribe birth control as a form of balancing, but for a lot of women who don't want to get onto, medication or pills, what is kind of the other remedies and solutions out there?
So birth control is definitely one of the treatments depending on the imbalance. So Navya, if you have an imbalance of LH, FSH, it's always birth control.
Okay.
If you have an imbalance of prolactin, you require cabergoline or caberlin. It's a tablet for, it's a dopamine antagonist. You need that. But if you have no hormone imbalance, if you only have irregular periods, you can be controlled even on diet and lifestyle.
Okay.
I would recommend a high protein, low carbohydrate diet and 1 hour a day physical exercise,
Okay.
lot of water intake, high fiber diet, no processed foods, no packaged chips, wafers,
Right.
no fancy fast food chains,
Right.
just your home cooked food, salad soups, a little boring but healthy life.
Okay. Um, and
Not easy. Huh?
yeah, it isn't actually, especially for us, and especially for, if you're in college, it's very difficult to kind of follow a healthy lifestyle
Yeah.
when you're a
I mean,
college
if you're
student.
getting an option to have a nice vada pav or a samosa or a hamburger, and you said, no, let's have a bowl of salad, you know what's
Yeah,
going to have the
I
salad.
definitely
I
don't
won't.
want to, but I think you can compromise somewhere and meet halfway with something like that. But is there a permanent solution to, fix chronic hormonal imbalances?
Unfortunately, there's no permanent cure. You can control yourself. See, there's a saying, it takes 21 days to form a habit.
Right.
So you have to have a very strict gynecologist like me, or a nutritionist, or someone who's actually going to make a diet chart for you, who's
Right.
going to give you your hormone tablets, who's going to give you a target. Like let's say, for example, Navya, no, not at all. Let's say we have another girl called Navya, and her BMI is 30, and her target BMI is 24. So roughly, we're talking of roughly around 15 kgs in a matter of 6 months. So you divide it, 2.5 kgs per month. How do you divide it? You don't weigh yourself every day. You
Okay.
work on your diet. You follow the breakfast, lunch, and dinner. You curtail your diet. There's something called as the sunrise to sunset diet. You start eating at sunrise, and before sunset, you're done.
Oh, wow. Okay.
So that also is translating into the modern day word called intermittent fasting now, where you stop
Right.
eating after around 9 a.m. or 9 p.m. or 8 p.m. and you eat next day after 16 hours. So that's also a little form of thing of fasting. A lot of hormones are benefited in that. So I would say diet, lifestyle, good sleep, You can't stay up late on your phone all night like that scrolling. Unfortunately, we all do that, don't we?
Right, we do.
So we tire our eyes and go to sleep. So what they say is little bit of a digital detox, little bit of a mind control. Keep your mind strong. Don't eat junk. However low you are, don't open a packet of peanuts or wafers or biscuits and munch up the whole thing. It's happened to all of us. Happened to me also. So you
Right,
have to work on your diet, your mind, your lifestyle, your sleep, and some form of physical activity. You want to do yoga. You want to do a little home workout. You want to go for a walk. You want to go to cardio. 1 hour a day sweat out.
right,
So
definitely.
I feel all of this is more beneficial in the long run to never get it, never uprising. You can control it. If you let your lifestyle go, let your body go, you will come back with it.
Right, right. And obviously not something that you can kind of control it with lifestyle. So it's not something that'll keep persisting if you're, leading a healthy lifestyle. But another thing that is really talked about a lot is hormone replacement therapy. So can you just explain to us what that is?
So I'm sorry for this, by the way. I don't know what happened. I little colds in the morning, got it worse now in the afternoon. But I want to answer this question. So you're talking of HRT.
Yes.
So now HRT is not falling in this topic of hormones in teens. HRT is primarily for women who are menopausal or perimenopausal. Now,
Right.
understand this. This is menopause. This is late menopause. This is perimenopausal around it.
Okay.
So a woman develops symptoms like hot flashes. She's sitting in a room with an air conditioner and fan on, and she's sitting absolutely everyone's fine, but she's feeling hot.
Right.
She wants a glass of water with ice. She's like, "What's wrong? Raise the temperature, raise the fan ka speed, or put on the AC again."
Right.
So that's one thing. She has vaginal dryness. She has anxiety. She has a little bit emotional instability. She's threshold for emotions a little wayward now.
Right.
So this is typically in a woman between 45 and 55. This is the average range of menopause. Such women, to curtail the symptoms of menopause, they have HRT, which is the same form of progesterone and estrogen, not like the birth control pills, in a different formulation to alleviate or lower the symptoms. So
Okay.
you can give it for a year, 2 years. I am not a big fan of HRT because there's also a risk and a benefit both. So you
Okay.
can try and use the non-hormonal methods. There's something called as non-hormonal HRT also. Very weird name. So they speak about soya, natural sources of estrogen, vaginal creams, mind therapy, meditation. So I believe more in that.
Okay, that makes
I'm
sense.
not a fan of giving hormones.
Yeah. So we have a few questions from the audience that people sent in.
We have
So
an audience. Okay, hi
no,
guys.
like like they
I know I'm pulling your leg here.
so we just wanted to run through them quickly so you can clarify all of that. So one of the questions is how to know if you are ovulating or not.
Yeah, very good question. Uh, there are 3 or 4 basic ways to find out. If you have regular periods. If
Okay.
you get a period within every 35 days, you have a regular period, you are 80-90% ovulating. But it's not
Okay.
100%. There's something called as the basal body temperature, BBT. So you'll feel a little warm mid-cycle, but again, not specific test.
Okay.
There are these urinary LH kits that come in the market that turn twin line when you are in the ovulation phase.
Right.
But there's nothing more conclusive than a blood test or an ultrasound. On the day 21 of your period, suppose your period came on the 1st of January. By the 21st of January, you do a blood test called serum progesterone. It should be above 5. That
Right.
is, you have ovulated.
Okay.
And the most conclusive is sonography.
Okay.
We do a nice internal sonography. We see the ovary. The ovary contains a follicle which has ruptured. And there's fluid in the pelvis. That is the 150% confirmation of ovulation.
Okay, that's interesting. I didn't know that.
So we do all this. This is my bread and butter.
So another question, which is quite interesting, is that does spearmint tea help in reducing facial hair due to hormonal
So you
imbalance?
won't believe it. There are these. I won't take names. Obviously, I don't want to get a notice tomorrow morning. So tomorrow is Sunday. I don't want to get it on Monday morning. There are companies that market spearmint tea on this basis.
Okay.
Now tell me one thing: if a girl wants to have flawless complexion, skin like Monica Bellucci or someone like that, won't she go and hoard the entire cupboard with spearmint tea?
Maybe not.
But it doesn't work like that.
Okay.
If you have body hair because of a genetic reason, let's say your mother or your dad's sister was a little bit hairier. You know how we have the Indian race is a little bit hairier than the Caucasian and the you know the other races. Just a second. No? Yeah. Can you hear me?
Yeah.
Yeah. Now, spearmint tea, there are studies done in Sweden and Norway regarding the Garcinia extract of the spearmint tea, which helps reducing the male sex hormone testosterone in females. So, on that basis, spearmint tea bags are being sold.
Okay.
But I haven't seen a patient who's had spearmint tea for 15 days or 15 months and be, doctor, I'm absolutely fine. No, it doesn't work that way. But yeah, there is a proper, if you go on to Google, there are many articles and many sponsored articles, idly to say, on the same.
Right. I know a lot of girls, believe that if you have spearmint tea, you can get rid of facial hair, and they
You
only wish.
forget facial hair. They feel they'll have body hair removal done.
I mean, if only it were that easy, it would
Yeah,
be
yeah, imagine.
great.
You
But
probably go to this thing parlor and get a spearmint tea to drink over there. That's what they do.
then all parlors would most likely be out of business. But the next question is back acne caused due to hormonal imbalances?
Yes, yes. So I'll tell you about this one case I had recently. So very, very simple. So she came with back acne. So we
Okay.
did the blood test. Every possible androgen. Androgen is the male sex hormone. All came normal. All came normal.
Right.
So she came for a follow-up wearing a black top.
Okay.
And she just happened to do this. You know how a girl would like make her hair.
Right.
And see like a pile of dandruff over here.
Oh, wow. Okay.
So even the dandruff, which is also called as seborrheic dermatitis,
Okay.
that falls typically over here. So let's say you're a girl with long hair. Won't your hair rest on your
Right. Yes.
shoulder and upper back? We treated her dandruff. We gave her dandruff preparations, and bang, 10 days later, reduction in back acne. 15 days later, no back acne.
I mean, I didn't know. I've assumed it was also because of sweat in the back that you get the
Now, I'll tell you. Now what happens is, let's say some girls have a little, on the hairier side. So
right.
there are some girls who have hair on their back. I mean, we have seen a lot of patients. Some have absolutely nothing on the back. So that doesn't add up to acne. Acne are either hormonal or because of this dandruff issue, which is again a form of dermatitis. It's also required. It's like a fungal infection. So
Right.
what happens is this is really distressing for a girl because I think some clothes you can't wear, some socially and all. But if you treat the dandruff and you also rule out the hormones, you can solve it.
Okay. That
It's quite simple to treat.
yeah. So another question was, does fatigue lead to increase in testosterone?
No,
Okay, that was
not.
good to know. Because I think we're all very fatigued, and if it was leading to increased testosterone, that would be a disaster.
This is a myth.
Okay. And can yoga help balance your hormones?
100%. So I've always believed if you do yoga, you are in control of your breath. Your
Right.
breath can control your mind. Subconsciously, in stress, when you have we have these many girls who come before their exams, their CET, NEET exams, 3 months in the library, three
Right.
months no period, 3 months acne, 3 months no waxing, 3 months no self care at all. We
Right.
have many of this age group in our patients. So
Right.
so once the exams get over, they lose little weight, periods are back to normal. So the subconscious stress causes the hormone levels not to drop. When the hormone levels are high, you don't get your period.
Okay.
So I always believe that yoga will help in all this. But it's a long term thing. You can't do yoga for one day and become okay.
Yeah, of course.
You got a course of no. Our generation is very क्या मुझे कल ठीक होना है. तुमको कल
Yeah,
ठीक होना है.
yeah.
Today
Also, how long would you say you need to really stick to your routine, your lifestyle, diet, exercise to really get the hormones in balance?
minimum 6 weeks, maximum lifetime.
Oh, wow, 6 weeks.
After 6 weeks of eating healthy, having a green smoothie, doing yoga, practicing meditation, will you notice, I'm looking and I'm feeling better.
Okay.
Nothing happens overnight.
Yeah, no, that's definitely true. But the last question is that if your AMH is very high, will it affect you getting pregnant?
No, not at all. So in PCOD, the ovary volume is larger. When the ovary volume is larger, you have more follicles. When you have more follicles, you have AMH. What is AMH? AMH is anti-Mullerian hormone. It's an ovarian reserve. How's your Hindi?
It's okay.
So there's something called in Hindi called "maa banne ki shamta."
Right.
Shamta means capacity, capability, reserve.
Right.
AMH is all about that. The Hindi word is more understanding than the English word. That's why I use the word.
Right.
Now, when you have more follicles, you have a higher AMH. But that does not mean you have a good quality of eggs in the follicles. You have more follicles. So a patient with AMH might require help, might require ovulation induction, might require an IUI, intrauterine insemination, might require IVF. But I don't see in IVF a patient with PCOS, PCOD, or high AMH having problem in conceiving. She might take a little longer, but they do conceive. They conceive, they deliver normally, all is well.
Okay. Amazing. Thank you so much for answering all those questions. I think I learned a lot myself. I wasn't aware
I'm still learning here. What you
of
learning?
these things. But thank you so much for answering all these questions for us and doing this.